Today we are talking about a new medication designed to save your kidneys if you have diabetic kidney disease. Hi, I'm Dr. Ahmet Ergin. I'm an integrative endocrinologist specializing in endocrinology. I use both natural and homeopathic remedies and pharmaceuticals only if the benefits is much greater than the risks. So today, I will talk about the benefits and risks of Kerendia, a new medication, that you will be able to decide whether Kerendia is a good option for you. Now, our kidneys are crucial, right? No objection to that. They clean our blood of waste and excess fluid while retaining the electrolytes and the minerals and proteins we require. They also help regulate blood pressure and they help produce red blood cells. The problem is that approximately 40 million adults in the US have chronic kidney disease, meaning that their kidneys aren't working properly. Most people with chronic kidney disease are diabetics too. So we need to do something about that. As you can remember, like using vitamins such as benfotiamine, which is a part of our neuropathy support, Sugarmd neuropathy support, is a natural way to lower your risk of diabetic kidney disease. But you want to use everything possible to lower your risk further. This is where Kerendia comes in. Now, FDA has authorized Kerendia. The active ingredient is Finerenone, a diabetes-related chronic kidney disease medication. This is the first drug ever actually licensed for this condition. So what is chronic kidney disease and how do you know you have it? And how do you know Kerendia is indicated for you? Chronic kidney disease is a disease where kidneys are damaged and they no longer work effectively. It is a progressive disease, meaning it gets worse over time and it cannot be cured. Just like your age, you cannot reverse your age and you cannot reverse a damaged kidney. But you can prevent further damage and progression to dialysis. And how do you do that? Let's talk about the stages of kidney disease before we start into dealing with how to deal with the chronic kidney disease. Now, stage 1 kidney disease is the mildest, whereas the stage 5 is a total failure. And many people don't show symptoms until late stages such as stage 4 kidney disease. And most of the time you will start having albumin in your urine. We call this microalbuminuria, which is a stage where you may have stage 1 or 2 kidney disease and sometimes stage 3 kidney disease, which is the first indication actually that you have to take action when the protein in your urine or albumin in your urine is rising. That is a time that you need to start thinking about doing something immediately to prevent further kidney damage. Now, what are the symptoms of chronic kidney disease? You are not going to get symptoms until it's really late, but if you are having changes in your urine production, if you're having shortness of breath, some swelling in your legs and ankles, etc., fatigue, high blood pressure, and so forth, hypertension and lupus and diabetes can all raise the risk of CKD as well, which is chronic kidney disease. Now, some medications such as NSAIDs, taking ibuprofen daily, or proton pump inhibitors such as Prilosec, especially long-term use of these agents, can make you more prone to chronic kidney disease. Now, why does diabetes raise the risk of chronic kidney disease, right? Well, as you know, diabetes causes chronic kidney disease in 1/3 of diabetics, unfortunately. Over time, high blood sugar really damages many organs, including the kidneys. Now, long-term elevated blood sugar increases the risk of chronic kidney disease. Again, remember, benfotiamine, for example, can help reduce the damage caused by high blood sugar. But high blood pressure, heart disease, obesity, smoking, they all increase your risk as well. So if you have diabetes, you should try to keep your blood sugar levels within the goal range that you and your doctor have agreed on. Now, with chronic kidney disease, the kidneys remove extra fluid from your bloodstream. Extra fluid puts more strain on the heart if your kidney cannot do that. So CKD patients are more prone to heart problems due to the accompanying high blood pressure, atherosclerosis, which is thickening of the arteries, that frequently coexist. Now, lowering your red blood cell count due to chronic kidney disease also raises your risk of anemia, which makes you tired as well. Now, delaying the disease progression and avoiding kidney-related complication is our main goal, and it should be your goal as well. Now, let's talk about the Kerendia and what it does and how it does. Kerendia is a mineralocorticoid receptor antagonist. Pretty long and mouthful, right? Well, we call them aldosterone antagonists as well. Now, you'll say that, oh, spironolactone or eplerenone are similar medications, but Kerendia is not a steroid. This means that it can cure more problems with fewer side effects than the other mineralocorticoid receptor antagonists. Okay? Kerendia is the first agent for that purpose, first mineralocorticoid receptor antagonist. Now, FDA has approved this medication just to treat chronic kidney disease related to diabetes. Again, we did not have a specific medication for that purpose before. Kerendia slows the progression of chronic kidney disease and lowers the risk of end-stage kidney disease, which means that when your kidneys basically stop working totally after reaching stage 5. It also helps lower your risk of heart disease and heart attacks. So Kerendia not only reduces your kidney disease, but also reduces the risk of heart attack and stroke, even the hospitalization due to heart failure, which is fairly common among people with diabetes. Now, how can Kerendia actually can prevent CKD complications? Well, you might wonder how one drug can do all these things, right? So it sounds to be like too good to be true. Well, Kerendia works by reducing the aldosterone's effect on kidneys, heart, and arteries. So what is aldosterone then? Well, aldosterone is a hormone that regulates the blood pressure, salt, and potassium. Super important, right? So this hormone is quite increased most of the time in patients with heart disease, high blood pressure, and chronic kidney disease. Now, too much aldosterone unfortunately causes inflammation and fibrosis in the kidneys, the heart, and the blood vessels. Well, this will cause kidney disease, heart issues, and blood vessel thickening or hardening, which we call atherosclerosis, that leads to heart problems. Now, Kerendia stops aldosterone from binding to its receptor, minimizing its harm. In turn, that reduces the risk of chronic kidney disease complications that we discussed. So if your albumin in the urine, or microalbumin we call it, is more than 30, make sure you discuss with your doctor about your option for Kerendia, see if you're eligible. But before you do that, before you jump on Kerendia, your doctor may not know too much about it because it's kind of a new medication. So I want to talk to you about the side effects. So the most common complication is high potassium. You can imagine, right? So only a few patients had low blood pressure and low sodium on it, very rarely, but Kerendia may cause potassium storage in your body. Now, potassium levels are typically higher in chronic kidney disease patients, so you may have to be careful about how high your potassium before you start the Kerendia, and you have to monitor your potassium levels, or your doctor has to monitor it 1 month after starting the medication. In my experience, significant elevation in potassium levels are not common at all because I monitor my patients after I start them. As long as you do not start Kerendia if your potassium levels are 5 or more to begin with. Now, what happens if your potassium goes too high? Well, too much potassium can be hazardous. You can have muscle pains, you can have arrhythmias, rhythm problems, cardiac arrest, all possible. Because of that risk, you should not ignore your regular blood test to check your potassium levels. Now, these tests can detect the excessive potassium levels before they become really problematic. What about the drug interactions? That's a common question as well. Well, you should be aware that Kerendia has some drug interactions. Eating grapefruit, for example, or drinking grapefruit juice while taking Kerendia will increase the risk of its side effects. Kerendia may also interact with CYP3A inhibitors, another mouthful word, right? Which are liver enzymes that play a role in metabolizing medications. Now, CYP3A4 inhibitors include clarithromycin, ketoconazole, fluconazole, diltiazem. So, ask your pharmacist whether any of your other prescriptions are CYP3A inhibitors and inform your doctor if that is the case, because CYP3A4 inhibitors can actually increase the effect of Kerendia way too much, and you may have to lower your dose or maybe not use it. Now, on the other hand, CYP3A4 inducers can render Kerendia ineffective. Inducers of CYP3A4 include phenobarbital, phenytoin, carbamazepine, and make sure you also do the same thing with your pharmacist and inquire about the inducers. Now, another question that comes is the angiotensin-converting enzyme inhibitors like lisinopril, or we call them ACE inhibitors, or ARBs like angiotensin II receptor blockers, such as losartan, or sometimes even non-steroidal anti-inflammatory medications such as ibuprofen may interact with Kerendia. But it's not a big issue as long as your doctor, again, monitors your potassium levels. In the study, most people were taking ACE inhibitors and ARBs at the baseline to begin with, and they were safe. You're going to be like, Doc, I like everything what you say, but how much is it? That's the next question, right? Well, I don't know the retail price of it exactly, but I would not recommend trying to buy it at its cash price. As of early 2022, insurance coverage remains poor, but the company, as far as I know, offers vouchers and coupons that you can take to your pharmacy, and they may help you use those coupons and vouchers if they are nice to you, or if you're nice to them. I hope this video helped you understand this new medication, Kerendia. Let me know your thoughts in the comment section below, please. And stay happy, stay healthy. See you in the next video. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it. And if you did,